Hello friends, my name is Dr. Harshendra Singh Chauhan. I am specialist internal medicine working in NMC Medical Center, Shahba since last 11 years. I have a vast experience of 22 years in medicine. My special interests are diabetes, thyroid diseases and hypertension. Today we will be discussing about a condition called hypothyroidism, which is quite common nowadays. Hypothyroidism is a condition in which your thyroid gland does not produce T3 and T4 hormones in adequate amounts, which lead to complications. Now coming to what is thyroid gland, it is a small butterfly-shaped gland which is located in front of your neck above the windpipe. The main function of thyroid gland is to produce two hormones, thyroxine and triiodothyronine, which regulates the metabolism of the body. It is very common. It is in Western culture, it is around 2.6% to 4.6%. In Middle East, it is around 5%. And in UAE, it was found to be around 8.8% in a retrospective study done in Hatta Sabab in September 2021. And in India, it is around 11%. There are multiple causes of hypothyroidism. First cause is autoimmune. The immune system of our body attacks the thyroid gland, which leads to reduced production of thyroid hormones, triiodothyronine and thyroxine. Second cause is previous treatment of thyroid gland with radioactive iodine. And third cause is like iodine deficiency. It is more common in developing worlds. There is reduction of dietary intake of iodine, which leads to improper production of thyroid hormones. Last one, there is interference of thyroid production because of certain drugs like lithium, amiodarone and certain interferons. There are multiple symptoms of hypothyroidism. Mostly they are similar to many other conditions and can be confused by other diseases. And the symptoms gradually progress over the years so that the patient may not know that he or she is suffering from a particular disease. These symptoms include tiredness, weakness, they want to sleep a lot, there is constipation, there is depression, high sensitivity to cold, the most common is weight gain, muscle spasms, muscle cramps, lack of concentration, decreased libido, sex drive. In females, there will be scanty periods or heavy periods. And nowadays, the late symptoms are not visible because the treatment starts early. The late symptom can be like dry, coarse voice, anemia, hearing loss, puffiness of face, loss of hair, eyebrows. Hypothyroidism is diagnosed clinically with their symptoms and by laboratory methods. The thyroid profile is done in which the concentration of TSH, the thyroid stimulating hormone, and T4, free T4 and T3 are monitored. The tests are preferably done in fasting states, but nowadays they can be done at any time. The treatment of hypothyroidism is levothyroxine. It comes in the doses of 12.5, 50, 25, 100, 75 and 150. The drug has to be taken daily at a particular time of a day in empty stomach, 30 minutes before the food or later on after the food. If you happen to skip the drug and you remember after 2 to 3 hours, you can take the drug in empty stomach. But if the time has passed a long time, you can start from the next day onwards at the same time. The side effects of levothyroxine is like palpitation, chest pain, sometimes patient may develop diarrhea, sweating, but these are not very common. If hypothyroidism is not treated properly, the patient can develop cardiovascular problems, they can develop goiter. In pregnant ladies, they can develop eclampsia, which is hypertension in pregnancy and fluid retention. And there can be birth defects in fetus, retarded growth of the fetus, and the last problem is myxedema coma. Myxedema is a grave problem in which the patient can lose consciousness because drastic decrease in the thyroid hormones, in which the patient is treated with IV thyroid hormones. Lot of people ask what to eat when they are hypothyroid and what not to eat. So the processed food containing like chips, sweetened cereals, beverages, sodas should be avoided, and goitrogenous food like soy and vegetables like cabbage, cauliflower, broccoli should be avoided. Patient can take fruits like apple, peaches, grapes, nuts, almonds, lentils, chickpeas. Gluten should be avoided. So the take-home message for hypothyroidism is that it is an autoimmune condition which will remain with you for lifelong, and the treatment will also continue lifelong. There can be drug-free periods depending upon your symptoms. When we do the test can be repeated every 3 monthly, 6 monthly or yearly depending upon your symptoms. The drug should be taken according to your doctor's consultation, and it is a totally manageable condition without any complication when the drugs are taken properly. So I hope I have been able to convey my message about hypothyroidism. If you want to know more or want to have a consultation with me, I am always available at NMC Medical Center, Shahba, Sharjah.